sure many of you have seen a skull before, but horses, when they're in, you know, this is a normal horse, you're looking at now. So it's got its incisors here, and then it uses the incisors to just chop the grass, and then it brings the food further back with its tongue, and then it actually doesn't chew in an up and down way like this, okay? They tend to have a sideways movement, and that's really important. So as they, every year goes by, their teeth, they erupt. I'll show you on this side. So you can see here, this is the tooth, the entire tooth in the mandible, so you can see how long it is. It's really big. And these are the little roots down here, and then because the tooth is constantly erupting, and because of this action of movement, it's actually worn down as time goes by. But because, can everybody see? But because the teeth don't actually go right sitting on top of each other, the top teeth are wider than the bottom ones, and as a result, they get sharp edges on the outside of the top teeth and on the inside of the lower teeth. And for that reason, that's why we need to each year have a look inside. Have a look inside their mouth to make sure there's no sharp points that are rubbing against either the tongue on the bottom or the cheeks on the top. And also, if a horse has a parish mouth, you know, if they've got an overbite, so their top incisors are sitting over the bottom ones and they're not meeting properly, you can imagine that these teeth aren't going to be meeting properly either, and so you get hooks on the front, and then at the back here, on the bottom, you can get really spiky pieces. So sometimes when you put your hand in there, it's really, really sharp, and therefore that you can imagine how painful that would be every time they chew. So if they're not chewing properly, or they've got pain, then they're going to have a less, like they're going to ingest less, and therefore probably be in poorer condition, or they're going to be in chronic pain. And so chronic pain leads to some stress, which can therefore have a negative impact on the general health of the horse. Plus, they're not probably eating their foods well enough or digesting what they are getting, and therefore, you know, you're putting potentially money in and you're not really getting the value out of it. And also, horses, as they age, those teeth, you know, they're pushing upwards, and when they're younger, the teeth are quite square on the surface, but then as the tooth erupts, it gets a bit more narrow. And therefore, when it comes to the gum line, you can sometimes get gaps in between the teeth. So if you can, everyone can have a look, like gaps coming in between here. And then sometimes they get food packed in there. And then you get, like, at the gum margin, you get a lot of grass packing in there, and that rots. And then you can get actually like a gingivitis. So that's again constant, you know, draw on the reserves and white blood cells, and it's like, and if it gets really bad, you're getting maybe bacteria circulating from the mouth into the whole rest of the body, so that's not going to have a good impact on fertility either, you know? So I suppose what I'm saying is the feed and nutrition and having correct dentition is very important for your overall health of your mare. So, because you want your mare to be in prime health going forward into the breeding season. So what we're going to do is sedate one of these mares, and I'll put the gag on. I'll flush out the mouth, put the gag on, and then you can have a look inside there. So she's looking a bit sedated now. Sort of have a look at the head, just make sure there's no like bumps or lumps. Because sometimes horses, if they've got, as you can see on the skull, the teeth are quite big, and they can go into these sinuses here, like the roots of them. So sometimes if they've got a diseased tooth, then can travel up into the sinus, and then they can get maybe a swelling here, just over time a gradual swelling, or you might notice a unilateral nasal discharge, so just a one-sided discharge can sometimes be smelly. We had one recently that was really green because of the bacteria in the sinus, and so it, that can be a sign that it's not just a cold, it's a one-sided thing, and it's likely due to sinusitis. So then you probably need to get maybe the horse x-rayed, because you can see in the sinuses, instead of air being in there, you'll have fluid. So it's just important to just look at the general sort of symmetry of the head. So then you can see there's not really any singular discharge, no lumps or bumps here. If I knock on her, she's quite hollow. Yeah, because if there's fluid in there, it'll be a duller sound, because it should be air filled. So we'll have a little feel along here and the mantle here. Feel for any swelling. You'll probably notice in younger horses they've got quite bumpy mantles, and that's because of where the teeth roots are. They're called eruption bumps. So the tooth root at the bottom is very close to
over the years, since you've been involved.
So we'll have a little look at her incisors. And as you can see, she's quite an old mare, because her teeth are quite narrow, and there's gaps in between a lot of them. Can you see that? See those gaps in there? Yeah. So one of the key things is what we call lateral excursion. So they should move like from side to side, so that gives an indication that her teeth at the back, that there's nothing stopping one moving across, because that's so important for them to chew. Okay, yeah. So that's all I can really see from now. So what I'm going to do is flush out the mouth. So this is just water with a bit of chlorhexidine. You don't have to use chlorhexidine. So I'm just going up the side and giving it, see all that stuff, that's all food that she's got packed in there. Just go inside. And I suppose the key thing is here, obviously handling any horses, you do need to be quite careful, and just bear in mind that even a sedated horse can suddenly get a fright or something. I was double-barreled very with a sedated horse one time. Unfortunately, they just are quite reactive sometimes. So just always bear in mind, the person holding the horse, don't be on the phone, the usual thing. Talking or thinking about something else. Just keep an eye as well when they're sedated. They can sometimes just lose their balance a bit. So the key about keeping them balanced is just keep their head up. You can just shake their head. So I'm just going to put this gag in now.
Because they've had a couple of cycles, and you should also remember that a mare showing ischias is a natural thing. It's a good thing, and they are cleaning out, aren't they? Carl,
sometimes they don't like it very much.
Any fluid in the uterus, that sort of thing. The cervix is relaxed. I actually find over the years I've got cats here, and I find.
So just make sure all her incisors are there.
A lot of fluid, and she's
slipped off.
In season, I'll leave her by the teeth
for
a few days, and she stands there looking at it, and it's a bit of a natural way of flushing out. Again, nature does these things for a reason. That's what I think we forget that sometimes. As the light lengthens, that's when they, that's when the production of
Now you might just have to come up one at a time, or two at a time.
And the GnRH. You've got to be careful with these maidens off the track.
Just so that you understand how far the teeth go back,
away from the others,
how you need to have a nice look.
You've got the pole.
Sorry.
Oh, wow.
See how far back you're going? That's a big tongue there. So you can imagine if you had a sharp piece there, it would be irritating, and the same on the gun. There is a bit of pigmentation, that's just her, the black is just her pigmentation, but you can sort of see that that would be a bit sharp there. So I'll just do an example of how we rasp them. So you can use these tools, which are just like hand tools. So You're right there.
Generally speaking, no, we would stick with the lights. But certainly stallions are very fresh and new at Malachi, so
So we can just go along, like as I was saying before, the inside of the bottom teeth tend to be sharper. Having a
So
look.
are you rasping on the flat
I'm
top
just-
surface,
I'm
or are you
sort of
rasping on the
using-
sides?
whatever you do, you just got to be very consistent about it. That's probably the most important thing.
I'm sort of rasping on the side to have it flatten it out a little bit on those sharp points. So I'm not going over the entire top surface, I'm sort of focusing on that. So you get a sort of a line like that. Yeah, and then that's just for, say, the bottom ones. And then because the arcade in the top is a little bit more bent around, we've got a slight angle. And so for the top one, so again, this is a bit dangerous, but you just have to trust your handler.
Sounds like my dentist.
So again, and then you can have a little feel and see that it's smoother.
So how often would you recommend the teeth being done?
Well, I suppose like if they don't have an overbite or they don't have a diastema or a hole, as I was talking about before, where the food is packing, probably once a year is generally okay. But if they have an issue, or sometimes a horse will lose a tooth, and so you can imagine if there's a big tooth or one tooth that's not being opposed, not worn down, then over time that's going to just get bigger and will affect that movement from side to side. So that's really important if they have a known history of having lost a tooth, that you get them done more regularly. Yeah, just to keep that down. Yeah. And similarly, if they have, as I was saying about a parrot mouth, if they have a parrot mouth, then you need to do those every 6 months.
And the other thing is, if this can be done out of season, it makes a big advantage, because if the mares arrive on the farms and the vets are looking and going, oh, she's not really doing that well after a month on the farm, we better check the teeth. Then you do the teeth, but then it takes another month after that before they get the progress from it. So it is a great thing. This is a great time of year to be doing teeth, I think. Wouldn't you agree that you're too busy too to be doing teeth in the season? If they can be done this time of year,
it's sort of an
makes a
autumn-
big difference.
Autumn job,
Yeah.
winter job, yeah.